Hey everybody, again we're here coming from Core Medics, Dr. Isaac Hill and Dr. Robbins. Um, we're again we're highlighting cases that are coming through the office that are just they need to be talked about, they need to be shared. So Doc, I understand that we had a patient come in the office and she was dealing with some neck pain. Can you kind of go
Sure.
into some more detail there?
Yeah. So actually, what she complained of, she's a regular patient, just comes in for maintenance care on a routine basis. But she mentioned to me that she was having some shoulder discomfort that was happening at night, and it was waking her repetitively. And the only thing was she couldn't reproduce it during the day. She'd get up in the morning, her shoulder, she'd move it around. She's like, shoulder feels good. I don't know what's waking me up. And so we just did a quick impromptu evaluation of her, and we went straight to her neck because, of course, the nerves that supply the shoulder and the arm come directly from the neck. And so that's how we found it initially. We noticed that she was having problems with the neck, and so we then progressed to taking some X-rays, just similar to these that are up here. And when we looked at her neck X-rays, she had real severe degenerative disc disease in the neck, and so we found out that that's what was happening. And we spoke to, here at Core Medics, we're a multidisciplinary team. We have a group of doctors, including medical doctors and chiropractors and therapists, and we spoke to our medical physician, the director of our program, and he thought she was a great candidate for regenerative cell therapy. And so we talked to the patient about it. She was gung ho because she was tired of missing out on that sleep, and so we took her into and started regenerative cell therapy with her.
Oh, that's awesome.
Yeah.
So let's go back a little bit. So what really kind of determines if someone is a candidate for stem cells?
So, stem cell regenerative cell therapy is really used when you've got some significant damage to cartilage, ligament, tendon, damage where, especially if they're, 40, 50, 60, and their body's not healing quickly, it's not healing as well as it used to, then those are the groups of people that, if they've got degenerative joint disease, they're a great candidate. If they have a degenerative disc, they're a great candidate. Regenerative cell therapy really utilizes stem cells and some other cells as well that come from the umbilical cord of a healthy born baby. And so they inject those cells, and we all, you and I have stem cells, and you folks that are watching, you have stem cells in your body right now. They're being made inside of the bones, but many times they're being made at such a slow pace that your body can't keep up with the degenerative process. And so this is just giving your body the building blocks to go ahead and repair that damage. And so
Like
that's
a recipe.
yeah, just like a recipe. You've got to have all the building blocks to be able to build that tissue. And so when we do that for a patient, the patient then will see cartilage begin to regrow. We'll see ligament and tendon damage that will begin to regrow as well.
Wow, that's really exciting.
Yeah.
It's really interesting. Can you expand a little bit of okay, so this patient, she came in, she was in severe pain, shoulder pain, she could not sleep well, she was being waken up at night. What happened after? What happened after she got treated?
Sure. So when she came in, we noticed that her range of motion, her movement in her neck was pretty limited. In fact, she probably lost 25 degrees of range of motion, which is about one third of her range of motion on each side. When she turned to the right, she turned to the left. And so um, regenerative cell therapy usually takes anywhere from 4 to 6 weeks to really start seeing progress with growing cell tissue back. But many of the substances that are injected are anti-inflammatory, and so they can have just like this real quick anti-inflammatory effect. So many patients will get the treatment and they'll be better within a day or two, where a lot of their pain will be gone. Well, this particular patient, she got up off the table, and our doctor, Dr. Black, asked her to turn her head to the right and turn her head to the left. She had all her full range of motion back. She was absolutely flabbergasted. She
Wow.
was like, yeah, I mean, mouths hit the floor, kind of, so to speak, because she had such incredible change in her range of motion, and that was immediately. And this is a person that has significant degenerative disc disease, and so we're excited to see she's got 95% pain relief in only a week and a half of these symptoms. Her shoulder pain, she actually said, is 100% gone. And so we're excited to see how it's going to regenerate and rebuild the disc in her neck, going forward.
Wow, is that the only thing that you're doing with the patient is just the stem cell or the medicine component?
No, so we've got lots of therapy type treatments that we'll do with patients. Now, some patients they just opt to just do a single or one or two injections, and maybe just one or two other visits. So sometimes a patient may only be 3 or 4 visits total. We've had a few that have traveled from out of state. Our furthest away is California that have come in for this treatment. We've had Pennsylvania, we've had New Mexico. So some of those folks will come in and get a couple treatments, but patients that are local, many times they'll opt to do things where we put them on a specialized table that will, stretch those joints open and close and help to bring back some of the healing fluids from the body that maybe that joint's kind of dried out. And so we'll do some of that. We'll do some exercise. We'll do some strengthening, things like that.
Sure.
Yeah.
Now you mentioned something about anti-inflammatory, and is there anything else that you have the patient do at home or?
Yeah. So many times we'll use, it depends on the case, but sometimes we have some devices that are home use devices that they can use to put on the neck or put on the shoulder, put on the knee that will actually stimulate blood flow to the area. And blood flow, of course, will carry toxins away. It'll carry inflammatory, type of components away. And so that helps. It helps with pain control. And so we'll have them do some things at home as well. But again, it depends on the case. And each case is kind of
So
a
does nutrition play a big role?
Absolutely, nutrition, and that's interesting. You asked that question, Doc, because we have a good success rate, but there's always a few that with any medical treatment that don't get well, and so we started asking questions from some of the other physicians around the country that are doing this. We're in a group of 350 clinics across the country that are doing this type of procedure, and we asked them, okay, what on the ones that aren't doing well, is there a common theme, a common thread? And we found out that diet plays a huge part in how effective this is, and so we'll take our patients and put them on an anti-inflammatory diet, and we'll get them the right nutrients, and so they're not constantly fighting against the stem cell.
Wow, it's exciting. The more we talk about it, it's just it's life changing.
Yeah,
These treatments.
and I had some treatment myself, and we don't have time for that today, but I can tell you, it is life changing for folks that are debilitated or facing major surgery or knee replacement or shoulder replacement. It can change their career and their life.
Absolutely.
Yeah.
Well, what would you say to someone that's listening to this and they're just kind of on their seat, they're at the edge of their seat and say, listen, I feel like that could be me. I feel like I need some hope. I've been so hopeless. I've been to several other professional docs, and just every one that they go to, they feel like they're just put on drugs. They're just put on, surgery is the only answer. What would you tell that person that's listening right now?
Yeah, so I would first of all share my, just very briefly, but I was told I had no choice but to have both my shoulders replaced, not just surgery, but actually replaced. And so that's what spurred me to get involved with this. But what I would say is that it's really easy to schedule just what we call a discovery visit to find out if you're a candidate at CorMedix. You can call our front desk. You can set up an appointment. It usually lasts between 45 minutes and an hour. You'll see a number of our physicians. We have a group of docs here, and then we're going to go through medical history. We're going to ask a lot of questions. We're going to do some screening exams, and then lastly, we'll probably take a couple scalp view x-rays to look at the joint and see if you're a candidate. Not everybody's a candidate. Lots of people are. In fact, the majority of people are candidates, but there's a few that, every once in a while we'll find one that's just too far gone, and we won't be able to help them, but we'll tell you right up front. You won't waste a lot of time. That discovery visit is an inexpensive way. We only charge $39 for that, so that's an inexpensive way for folks to find out if they can be helped.
Love it. Discovery. Yes, we're not here to put you in any kind of trap. It's just all about just real nonchalant. This is what kind of our facility looks like and what we're all about. So it sounds like if this is you and this is speaking to you right now, call us up. CorMedix. Our number is 434-797-4455. Thank you. See you next time.
Thanks.